Okay, good morning, folks. I'm Mike Settas. Here today to talk about some changes in the healthcare industry in South Africa, and what government's put through some recent regulations, the demarcation regulations. So just want to have a little chat around that to see and explore the ideas of why we don't think it's such a great idea, or certainly I don't. If we have a look at the various sectors in healthcare, we've got the state sector, which is struggling at the moment. It has for a number of years, so we see shortages of providers there. But at the same time, the government's proposing and has already now published a white paper on a proposed national health insurance. This has been widely criticised. Besides the fact that we have this shortage of providers in the country, we're also facing a massive cost burden with trying to run a national health system. Whilst it's laudable in its intent, we really have to question some of the numbers around it. Some local economists have pegged the cost at an additional 200 billion rand to the fiscus. So really, we can't see how that's possible to raise the kind of money, especially given that the economy is also pretty flat at this point in time. The other issue is looking at the private sector, which is really largely made up of the medical scheme industry, that is able to provide high levels of care. But the way in which the legal framework of the medical schemes market is made up, it really is only able to supply healthcare to really high income earners. So it's quite exclusionary in its structure. And also it's coming under huge cost pressure. Cost increases year on year are outstripping inflation by a significant number. Although the actual increases in contributions are typically around 3.5% to 4% above CPI. Once you add in other factors such as out-of-pocket costs, growing shortfalls, you're probably looking at somewhere close to double CPI. So the sustainability of the private sector in its current structure is quite questionable. So the point that we're really trying to get at in terms of that is the entire structure needs to be looked at, both the public and the private, something that is sustainable and can cover basically all the citizens of the whole country, rather than sort of have this private sector that's only covering the top end, and then public sector really is just left on its own. So in the interim, and now more recently, the government has passed the demarcation regulations. Now what these regulations do is exclude any other entities in South Africa besides medical schemes from covering healthcare. So it means it cuts out the whole insurance industry, which could, if enabled through legislation, be able to provide lower cost alternatives to South Africans right now. Now the rationale for us around that is that it would provide people with the options of purchasing lower levels of cover that they can't afford. If they can't afford a medical scheme, then they have nothing. So now the option is they could have something in the interim, and also to alleviate state. So we don't quite understand the rationale beyond the demarcation regulations, taking away rights from people in terms of covering themselves. So we really do question that, and it's something up for a discussion that I think we probably should try and have. And the one thing that really, just to finish off in terms of that, the one thing that really is a question is that the health inquiry being undertaken at the moment by the Competition Commission, it's by far the most comprehensive and wide-ranging study or inquiry that's ever been done in the private healthcare industry. So really trying to understand why the government would pass regulation and impactful regulation that's having a meaningful change in the industry before the findings of this inquiry comes out. It doesn't seem to really make any sense. So really a few questions around that. Why these regulations have come out now, why cut out the rest of the industry, why make it an exclusionary system that only the rich can afford, and why not wait for the healthcare inquiry to come out. So we hopefully at some stage we can engage, and we'll see where that goes. Thank you very much for your time.